Hello and welcome to my channel. I'm your host and tutor, Annalise Garrison, and I have been healing the community one student at a time since 1997. And today we are going to learn about prioritization and the NCLEX. You know how you can narrow these answers down to two choices and then you have to pick the best answer? And that's where most of you get stuck. You always pick the wrong answer. You don't understand how to pick the right answer. Well, you have to learn how to prioritize your answers. And that's what I'm going to be teaching you today. Okay? And we're going to learn this by first looking at paying attention to the wording. The second thing we're going to look at is we're going to prioritize by staying in the now. We're going to prioritize by learning the steps of prioritization. And then the fourth thing that we're going to learn in order to be able to prioritize our answers is various bullet points that I want you to remember. So let's look at the first. Pay attention to the wording. What is that all about? Often when we take an exam, we are always looking for the right answer. We always have to pick the right choice. But sometimes the NCLEX asks you to find something that's wrong, something that's incorrect, right? So when you look at the question, always say to yourself, does this question want me to look for progress or look for something that needs follow-up, look for something that's wrong, right? So decide, am I looking for something right or am I looking for something wrong? If you see any of these 6 words, it means that you're looking for something that needs your attention. If you see the word follow-up, risk, clarify, immediate, notify, or intervene, these are all words that tell us, hey, our client needs our attention. So in this case, you do not pick progress. You do not pick the right answer. You pick the wrong answer. You pick the answer that needs follow-up. Now, having said that, let me give you some words that'll clue you in to tell you, hey, you better prioritize this patient. And these are some of the words. Essential. What does essential mean? Essential means extremely important, absolutely necessary that you have to do it. So when you see the word essential, you know it's a priority. Now, first is not as easy as it seems. Now, because you're going to look at all the patients, right? But who would you see first? Which patient is the most critical patient? Which patient is the most unstable patient, right? This is the patient we're going to see first. Now, for some of you, English may not be your first language, or for some of you, you haven't seen questions worded like this in your experience. So this is why I'm going over all of these words. So again, highest priority means the same thing as first. Who is the most critical? Who is the most unstable? Who takes the highest priority out of all of your choices? Which one are you going to see first? What takes highest priority? And it's hard to know who to prioritize, especially if you don't know the illness. Now, every once in a while, you're going to come across a question where you don't know the illness. So this is why I'm going over each and every one of these. Now, immediate means right now. Do it now. That's what immediate means. Do it now. Who are you going to see now? Right? Some people have problems with the word initial. Well, initial just means occurring at the beginning. Alright? So when you see the word initial, picture in your mind that you just started your shift, you got report on these 4 patients or whatever the case may be, and what is the first thing you're going to do at the beginning of your shift? Who is the first client you're going to see at the beginning of your shift? What client needs to be seen first? What client can wait? You see? Most important. What does important mean? It means of great significance or value, likely to have a profound effect on survival or well-being. So when we say which client is most important, think of great value that you have to check on the client right now. What is the most profound effect on success, survival, or well-being? When we see the word likely, that means that it is something that is expected to happen. So, which client is most likely to blank, okay? So, which client is most likely to whatever, right? Likely means expected to happen when you see that word. Next is another priority word. In this case, it means to come immediately after something, right? It doesn't mean, after the nurse takes a coffee break or after this patient comes back from physical therapy. In this particular case, next means who would you see immediately after you do this? You understand? Very good. All right, let's continue. Everybody's doing fabulous. When we see the word primary, that means of chief importance, right? Primary care provider is your chief, the head care provider, right? So primary means your main focus. So which patient would be a primary concern means which patient would be your main focus. The word vital, when it comes to the NCLEX, vital means that it's absolutely necessary for life. So which action is vital to take means that it is absolutely necessary for life. And our last one here, appropriate, means that it is suitable or proper in the circumstances. It is the correct action to take. So when we say most appropriate, it means what would be the best action to take, right? What is suitable, what is proper in the circumstances. This brings us to the end of our series on prioritization, part 1. There will be a part 2, 3, and 4 to follow. I will have the link in the comment section. This part was just about words that will clue us in on what to prioritize. And also don't forget the words. Are we looking for progress, or are we looking for follow-up? Let's not forget these words, ladies and gentlemen. They're very, very important. Now, part 2 is going to cover stay in the now, not the past or the future when we prioritize. So let's look at that.